I'm Dr. Pri, and this is the Longevity Now podcast, where we distill insights from the frontier of longevity and preventive medicine to help anyone live healthier for longer. The Alzheimer's test that your doctor may not have told you about. And no, this is not a conspiracy theory. This is because it's a very new test. And as you may have heard me talk about, part of the challenge with modern medicine and part of what we try to solve with longevity is making sure these discoveries that are found in modern science get to you, the patients, the viewers, the listeners, as soon as possible. It doesn't happen as much in the traditional US primary care system, but that's why we're here. What is this new test? It's called phosphorylated tau 217, and it is now the gold standard in detecting Alzheimer's dementia, especially detecting it early. This is from Time magazine. Great graphic here demonstrating what this is. In Alzheimer's dementia, just a little bit of backstory, there's a specific protein called tau, and that protein doesn't get cleared properly from your brain, and it builds up in certain parts of your brain, eventually over decades, leading to the symptoms that you see with Alzheimer's dementia. Now, this test, phosphorylated tau 217, detects some of this tau protein that has been modified or phosphorylated in a specific part, receptor area 217. And this modification only really occurs in Alzheimer's disease, and it gets out into your bloodstream. So it gets out of your brain spinal cord system into your bloodstream, which makes it much easier to detect. And abnormalities in the removal of this tau protein, as I mentioned, is what causes Alzheimer's. So it's really useful for us to get a simple blood test to figure out what might be going on. And as I mentioned, it's really specific to Alzheimer's dementia itself, as opposed to other types of dementia, such as vascular dementia, which is the second most common type of dementia. A phosphorylated tau 217, mouthful, we call it p-tau 217. It became available for research labs in the 2020s, and then it was FDA approved for clinical use in May 2025. So it's very new. We're talking not even really a year out, but you can get it in a lot of places. And I'll talk about the logistics in a little bit. It's been so useful, it's quickly become the gold standard for diagnosing Alzheimer's dementia, and especially diagnosing it early, to the level where when they do clinical trials for new medications to alter Alzheimer's or delay the progress of Alzheimer's, they use this to tell if those drugs are working. So it's pretty much become a diagnostic standard on the cutting edge there for Alzheimer's dementia. What used to happen is you would wait for people to have symptoms. And this could be really tricky because the first symptom of any dementia, including Alzheimer's, is you start having memory loss. But as people get older, there's a normal amount of forgetfulness that happens that doesn't eventually progress to full-blown dementia, which is what you want to avoid. It can be tricky because of that to figure out, is this person not remembering because of their Alzheimer's, or are they not remembering because it's normal and it's not going to progress, which historically has delayed the diagnosis of dementia because you're not sure what the real issue is in that situation. So back in the day, somebody would start forgetting. Maybe they have dementia, maybe they don't. Maybe their family picks up on it and even takes them to a doctor. Maybe they don't, until the symptoms start getting more progressive. Now they're having behavioral issues. They're getting angry. They're not their self anymore. And the memory issues are getting much, much worse. Well, at this point, it's harder to intervene, do anything about it. And even then, they would need a spinal tap or brain imaging to confirm the dementia diagnosis. So a lot of times, these folks who are being accused of having dementia by their family members get really upset. They don't want to feel like they are losing their mind. It's not a great situation in terms of diagnosing it, and that's part of the reason why it was so scary. Now, this p-tau 217 test, it'll start showing an increase in your blood levels of p-tau 217 10 years before the onset of subtle memory issues. And that's for 99% of people who get Alzheimer's. There's a very small 1% of people who have Alzheimer's they're going to get it for sure based on the genetics they've inherited. For those people, the p-tau 217 starts rising 25 years in advance. So it's even more of an early warning sign for those folks. So you get an extra 10 years before you even have this mild cognitive impairment, is what they call it medically, or those early memory losses. And on top of that, it's not subtle. You know that it's happening. There's no question of, is this a regular older person forgetting things? Maybe they're distracted. No, there's unambiguous that this is what's happening. So it's a huge wake up call that the disease process is happening and therefore is super useful. So what do you do about it if you get a p-tau 217 test and your levels are rising? Well, great question. Actually, let me go back and show you this chart here. So this chart is showing estimated years to symptom onset of these different Alzheimer's biomarkers. And here, this dashed line going vertically is the time when symptoms onset. You can see here there's different curves, and the p-tau 217 is this one here in the orange right here. There's a couple that are a little bit, that there's one called amyloid pathology that will show up earlier, but it's very hard to detect this and it's not as specific, which is part of what makes this p-tau 217 test so useful. Point is, you can really aggressively start addressing the risk factors of dementia. I've mentioned these before, but these are cholesterol, blood pressure, inflammation, insulin resistance. Then there's other things you can do like sleep, exercise, sauna. There's a lot of potentially interventions that are in your control that are not even medications. In fact, there aren't any great medications at this point, which is good and it's bad. It's good because it's fully in your control. It's bad because it's going to take a little bit of effort and lifestyle change. But it is a wake up call that you can do something and slow down the progression. It's early days for this blood test. As I mentioned, in the research world, I've only started using it since 2020. So at the time of this recording, that's just over 5 years. But there is some evidence showing that you can, by utilizing exercise, slow down the progression of that p-tau 217 rise, which indicates you're slowing down the progression of your Alzheimer's dementia that's kind of slowly accumulating. Again, this is way before you even have any symptoms of it. So now we have an early marker to actually do something about this. A lot of folks in the field think eventually this is going to be like getting a cholesterol check and being able to intervene and modify it to the point where you don't have a heart attack. That would be amazing. So this is a really cool test. Let's talk logistics. It's not covered by insurance. It does require a doctor's order to send it through. However, some places like Function Health will let you order it directly. They kind of have a doctor on the back end who does that for you. And we're going to talk about them in a second. Cost between $300 and $500, depending on the agreement that the ordering clinic has with the lab that's getting it drawn. I have a deal with Quest. I can get it for $291 for my patients. I don't take any margin on it. Some places probably do. I don't know exactly what Function charges for it, but it's pretty widely available. You show up, you get a blood test like everything else, about a few days to a week, you'll have your result. There you go. I think if the result is normal, getting this checked every 2 years is reasonable, maybe every 3 years, depends on if you have a high risk of Alzheimer's dementia, meaning you have either a gene that puts you at higher risk, you've had a lot of head injury in your past, maybe from sport, or if you have a strong family history. Any of these things could make me potentially want to check it earlier. And again, you can do something about it, which is the whole point of this test.